paper is called Deja Vu. Medical marijuana, where are you? Let me explain. Back in 1979, I appeared before a legislative forum who at that time then referred the problem of marijuana to the pharmacists. Now we're doing it in reverse. We're going to the pharmacists to refer it to the legislature. However, being a student of the Bible, this also brings me to mind in the book of Genesis, where the Jewish nation was going to the promised land. They wandered around in the desert for 40 years. And then they got to the promised land, and they sent 13 spies into the promised land, and they came back, and 11 people said, "Oh my God, you cannot go in there. The people are huge. They're probably over 5'7". And 2 people said, "Go in, do it." And they were Caleb and Joshua. But they went back out into the wilderness for 40 years, turned around and came back. When they got there, Moses saw the promised land. He died, but Caleb and Joshua got in. So here we are with this position now, because I'm back here 30 years later with the same problem. So I don't know whether I'm Moses and going to die, or whether I'm Caleb and Joshua going to be able to see something happen. And with that, I'll read my paper, which I call Deja Vu, Medical Marijuana, Where Are You? Ladies and gentlemen of the Iowa Board of Pharmacy, thank you for allowing me to address you regarding this subject. I did the same thing 30 years ago to the Iowa legislature. I will focus only on the medical use of marijuana, not its recreational use. The people who need recreational marijuana already know how to get it. A bill was approved on June 1st, 1979, which appropriated $247,000 for the Board of Pharmacy Examiners, which was contingent upon the Board of Pharmacy Examiners establishing a therapeutic research program within 90 days of the effective date of that act. The board was mandated to organize a physician advisory group to advise the board on the structure of the program, which was never operational. Today, therapeutic research program laws are no longer effective because of federal obstructionism. The dual scheduling scheme still exists in the statute, but the language for the therapeutic research program, Administrative Code 620-12, was active October 1st, 79 to June 30th, 1981. And then it eventually was removed in 1987, and it is now currently just symbolic. Should suffering patients be criminalized? There were approximately 830,000 arrests, 99% by local, not federal, officials in the United States in 2006. 89% of these were for possession, not sale or manufacture of marijuana. Even if only 1% of those arrested were using marijuana for medical purposes, then there are more than 7,000 medical marijuana arrests every year. Here we are 30 years later in Iowa, and the marijuana debate continues unceasing regarding marijuana and its use in medical spheres. Since 1979, and especially since the mid-1990s, there have been numerous studies that have shown that many patients suffering from AIDS, cancer, multiple sclerosis, epilepsy, Lou Gehrig's disease, severe or chronic pain, severe nausea and vomiting secondary to chemotherapeutic drugs, severe or persistent muscle spasms, and other debilitating illnesses that find that marijuana provides some relief from their symptoms. Available prescription drugs often come with far more serious side effects than marijuana. And many patients, that doesn't count. And many patients who find relief from marijuana simply do not respond to other prescription medications. In 1999, the Institute of Medicine, which you already mentioned, showed there was great relief for marijuana. In 1988, after reviewing volumes of evidence on marijuana's medical use, the Department of Enforcement Agency Chief Administrative Law Judge Francis Young found that maintaining marijuana as a Schedule I drug would be unreasonable, arbitrary, and capricious, and that marijuana in its natural form is one of the safest therapeutically active substances known to man. Last year in 2008, the American College of Physicians, of which I am a member, I have been a fellow of the American College of Physicians since 1968, came out with a position paper on the therapeutic role of marijuana in certain conditions, but also came out with this, I skipped the line, which stated the conclusion: evidence not only supports the use of medical marijuana in certain conditions, but also suggests numerous indications for the cannabinoids. Additional research is needed to further clarify the therapeutic value of the cannabinoids and determine optimal routes of administration. The science on medical marijuana should not be obscured or hindered by the debate surrounding the legalization of marijuana for general use. The position paper of the American College of Physicians also stated, quote, given marijuana's proven efficacy at treating certain symptoms and its relatively low toxicity, reclassification would reduce barriers to research and increase availability of cannabinoid drugs to patients who have failed to respond to other treatments. Since 1996, 13 states have enacted laws that effectively allow patients to use medical marijuana despite federal law. Those state laws have removed criminal penalties for patients who use and possess medical marijuana with their doctor's approval or certification. These laws are working well, enjoy popular support, and are protecting patients. Data have shown that any concerns about these laws increasing youth marijuana use are unfounded. 11 of the 13 medical marijuana approved states that have produced before and after data have reported overall decreases in teen marijuana use exceeding 50% in some age groups. It has been said that it is easier for a teenager to buy pot than a six-pack of Coors. Right now, under Iowa law, it's illegal for seriously ill patients to use medical marijuana under the supervision of their physicians. If the patient with one of the devastating diseases stated earlier desires the use of marijuana, they then must grow it illegally or buy it on the criminal market. Therefore, cash goes into the purses of drug dealers or drug gangs instead of into the coffers of the state through manufacture, distribution, registration, and taxation of marijuana, which could add up to hundreds of thousands of dollars yearly.